In terms of treating the fertility aspects of PCOS, so this is for women who are not ovulating or not ovulating on a regular basis, really there are 3 options, 2 of which are the most commonly used. The starting point for ovulation induction, the best method to start with is to use a drug called Clomid. This is a tablet that you take for 5 days at the beginning of the cycle, and thereafter have regular ultrasound scans to check that the dose is correct. So that means that we do have a follicle growing in response to the Clomid, and it's the follicle, of course, that contains the egg. But it's important to make sure we don't have too many follicles growing. The next line is usually to move to injections. And these are daily injections that the woman will be taught to give herself, or her partner can give them. And again, just like with the Clomid, it's very important to have regular scans to make sure that she is responding to the dose of treatment. With the injections, usually the dose of medication is increased every week. That's what's called a step-up regime. But just like with the Clomid, we want to make sure that there aren't too many follicles growing because of the increased risk of multiple pregnancy. An alternative form of ovulation induction is actually an operation called laparoscopic ovarian diathermy, often known as laparoscopic ovarian drilling. And this is probably a better alternative for those women who, for whatever reason, are not able to attend for regular monitoring. Or for those women where there might be concerns about perhaps some anatomical issues with her pelvis. So if there are issues whereby one feels that actually having surgery is justified, there's an additional benefit from having a look inside the pelvis, then they're the type of situations when ovarian diathermy is recommended. It's probably also just worth spending a moment thinking about metformin. Metformin is often patients often will ask me, should I take metformin, or they might come to me already on metformin. The advantage of metformin, if it works, is that it does not require any regular monitoring. So if a woman's taking metformin, she does need to be monitored to make sure that it is helping her to ovulate. But the problem with metformin is that the pregnancy rate isn't very high per ovulation. And certainly when you compare it to Clomid, for example, the pregnancy rate per ovulation is almost 3 times as high with Clomid compared to metformin. So generally speaking, metformin is really only suitable for a limited number of people where coming for regular monitoring is not appropriate for whatever reason.